All right, work me through this question here.
Okay. Which of the following compensatory mechanisms is activated in response to this patient's acid-base imbalance? Decreased renal ammoniogenesis, hyperventilation, increased renal bicarbonate reabsorption, respiratory alkalosis, or vasoconstriction. A 50-year-old man with a history of smoking presents to the emergency department with severe shortness of breath and productive cough. He has a fever and appears to be in respiratory distress. A chest X-ray reveals consolidation in the right lower lobe, and the patient is diagnosed with pneumonia. Arterial blood gas analysis shows a pH of 7.3, PaCO2 of 55, and bicarbonate of 24.24. Which of the following compensatory mechanisms is activated in response to this patient's compensatory mechanism is activated in response to this patient's acid-base imbalance? Okay, so given that he has super high PaCO2 with a low pH and he's acidotic, the thing that would happen, he's in respiratory alkalosis or acidosis, and what would happen is you would increase your reabsorption of bicarbonate. So I'm going to say C, and that's my gut, at least. That's my gut answer.
Okay,
I don't think it's hyperventilation. Do you do that? So this is another thing. Like I have my gut answer, and I feel like I'm pretty confident with that.
sure.
Um, do you look at every answer now and say, okay, this is wrong, this is wrong, this is wrong, this is wrong, and then okay, this is right?
Sure. So usually what after I pick my gut answer choice, right, depending on how strong I feel about my gut answer choice, if I'm like, it's decent, then I would say, okay, maybe I'll still look over the answer choices and kind of work through them fastly. But if I'm super confident, then I take like maybe 1, 2 seconds and be like, yeah, the rest are wrong, right? So that's what I do personally. Everyone has a little bit different of a mechanism, it just depends on how confident you are, I would say.
Okay. Okay. The only other answer then that could make sense is hyperventilation, because you're trying to get rid of all of that CO2. But I feel like the compensatory mechanism, if you have respiratory alkalosis, is metabolic. Respiratory acidosis is metabolic alkalosis, and it's a delayed response that happens by increasing renal bicarbonate reabsorption. So
Okay.
I'll say that.
You're gonna keep with that answer?
Yes.
Okay, bingo, you did that perfectly. So I'm going to talk about a couple of learning points here. So tell me, what is the normal range of blood pH? Let's start.
7.35 to 7.45.
Okay, perfect. Bingo. So the reason why I'm mentioning this is you got to memorize this. Of course, you can always pull up the reference sheet on the test, but it just takes too much time. So knowing these values is super important. What's the normal value of PaCO2?
Oh, I think it's 30 to 40, 33 to 45, I think.
PaCO2 should actually be, I want to say it's 40. Okay,
Okay,
but let me
40.
check for you. I'm pretty sure that's the number I usually use. PaCO2 is usually 40.
I just know if it's in the 20s, it's low.
Yeah,
If it's in the 50s, it's high.
I use the number 40, but they say the normal range is 35 to 45. Okay, and then how the PaO2? You
Oh
know,
my gosh. Is it, I think in like, is it like 60 to 80? I have no idea.
I'm pretty sure it's 100.
Okay, it's just perfect. Okay.
Yeah,
It's
pretty
100.
sure it's 100. Yeah. Okay, so
This
these are
makes
kind of
sense.
things, and then bicarb. Do you know what the normal bicarb is?
I think it is. I actually don't know the normal bar carb. I forget these things.
Let's see, normal bicarb because I don't want to be.
24 sounds right
Yeah,
to me.
usually 22 to 32 is what they kind of say, or 20 to 30, right? So, around kind of this range, 20 to 30. Okay. So let's talk about this, right? So the reason why I'm mentioning this is we can easily kind of come up with an answer if you kind of know these values, right? And kind of work at it, right? I always
Mhm.
personally start at the pH, right? So the
Mhm.
pH is acidotic, right?
Yes. So it takes away any type of like, it takes away D immediately because it's not, it can't be alkalosis, it's acidotic.
Exactly, right? So the overarching issue, well, it says, compensatory, but anyways, the diagnosis itself is something that's acidotic. So I always start with the diagnosis here. So you can tell that he's in respiratory acidosis.
Mhm.
Okay. Because I mean, on a clinical standpoint, he's a smoker. So, he has COPD 100%, right? Now he's in respiratory distress, coughing a lot, right? And he has pneumonia also on top of his COPD. So he's just not breathing well, right? From his COPD
Mhm.
and his pneumonia. So he's retaining CO2, which makes sense here, right? His PaCO2 is very, very high, right? Which is greater than 40, meaning he has respiratory acidosis. So the only way that your body can compensate with that, right, is the reverse, which is metabolic alkalosis. Doesn't make
Mhm.
sense. So C
Mhm.
has to be your answer. So if you talk about hyperventilation, right, your body's primary pathology here is you're not breathing. So this is actually complete opposite. Does it make sense?
Yeah, it actually does make sense. Like you can't hyperventilate in this situation, right? Because the problem in the first place is hypoventilation.
Exactly. Bingo. Right. So that's why I wanted to talk to you about it so that you can kind of see it because sometimes what ends up happening is a lot of students do exactly kind of what you did is that you kind of are, how do I say, is jumping a ton of logic, which is how you got to hyperventilation. Does it make sense?
Yeah, I had to say, well, it could be this because your body could do that to do. Yeah, I had said a lot of could.
Exactly. So you want to keep it straight to the point, right? Oh, it's respiratory acidosis. So the only way you can compensate is metabolic. You know what I mean?
Hmm.
So,
Hmm. Very
all
cool.
right. Perfect. Let's go to the next one.